So the task I was given was to talk about how to get all the different doctors together. And I've seen there are 50 people on board joining this Zoom meeting. And I will try to guide you through this say, complicated system of various specialists and doctors and how you can create and find that. So if you go to the German-speaking part of Switzerland, I've seen there's Geneva and Lausanne very well organized. And then we have Bern and we have a question mark for Zurich. And there is no one in the southern part of Switzerland right now. If we go for, and that's the reason why I do it in English, so that the German-speaking and the Italian-speaking patients can follow. In Bern, so in the German-speaking part, we have a slightly different organization, and I will explain that in a minute. It's an interdisciplinary center for rare cardiovascular diseases, and morbus Osler HHT is a vascular disease, and that's the reason why it fits in here in Bern into this setting of rare diseases. Rare diseases, that's the problem we face here. And you can imagine if there is a referring doctor, how do you get your patient through the jungle of different specialists to get the right patient care? Personally, I'm head of vascular medicine and I'm co-director of the vascular malformation program here in Bern. And that's more the overall umbrella of it. The Swiss Cardiovascular Center, that's vascular medicine and cardiology and head and vascular surgery, have a center, a joint center of rare cardiovascular diseases. That makes it much easier for us physicians to get all the different others on board. We are well known for this, and the Osler fits into this as well. So the interdisciplinary approach for other physicians in Inselspital and for referring physicians is maybe well done via the Rare Cardiovascular Disease Coordinating Center. So this is an overview. So we have inheritable disorders of large vessels, say Marfan disease, we have arrhythmias, we have congenital heart disease, and this is what I want to talk about today. This is congenital vascular malformation, and we have the same approach for, say, if we go for the heart or for large vessels or morbus Osler. We need clinical awareness and information, and I'm so happy that Ms. Duckman took over this patient organization to create this awareness and information like the day to day. We need an advanced genetic identification that becomes more and more important for all these different diseases. Plus, we need patient-tailored treatment and family counseling. And I've seen or recognized already with the different questions by the patients being on board that this counseling is an important part in this patient treatment. So if I have to treat a pneumonia, it's pretty straightforward. So the patient gets antibiotics, and the time later, patient is healed and is well and everything's okay. But here there are family members, there is different guidelines we have to follow, there is a multi-systemic disease, and that makes it so complex. Don't be afraid, I will guide you through this slide. So the overheading is rare congenital vascular malformation. And if we look here, we have some of this vascular disease. It's all vascular disease, including Osler or hereditary hemorrhagic telangiectasia, HHT. Here we have an inheritance. So it's an inborn germline mutation. If, say, other patients coming in with vascular malformation, it might be later in development, they have a mosaic mutation. It's not inherited. So there are single person in a family that maybe have an incidental vascular malformation. It's completely different if we talk on hereditary hemorrhagic telangiectasia. It's a 50% chance to get the disease for a child. It's different in Marfan syndrome as well because there are different genes involved, and the inheritance, so that this is really the phenotype of a child or an adult, is much lower. So this makes HAT so special in the overall congenital vascular malformation settings. Coming back to that, you already heard that. This is just a little drawing to show really pretty clear how many children will be diseased. So if you have mother and father, and there's just the affected father, 50% of the children will have the disease. That doesn't mean that the child will have the disease first years of birth. First is often that they have epistaxis or the small angiectasis at the lips or the palms. So that can be undetected until they are maybe 10, 12 years of age. And that's often already the first question of the parents. So I have a child. When do I have to screen and test my child? And that's important to get a geneticist on board and someone who has enough knowledge to calm down the families, because as parents you always want to do the very best for your child, and you really have to give them good information to guide the families with their children through this disease, through this inherited disease. So it's autosomal dominant. So it's a 50% chance that a child will get the disease. In Switzerland, it's a 1 by 5,000 to 8,000 living birth. In Switzerland, that's about 1,000 to 1,500 patients. That's the reason why we say it's still a rare disease. And it might be that the family doctor or say general practitioner can't really cope with this disease and should refer the patient to a center who has all the different specialists. And it's, at the end of the day, a vascular disease. It all comes back to vascular disease. That's the reason why here in Bern, it might be in other centers, the lead is with throat and ear and nose specialist. In other centers, it's the hematologist. It varies a little bit. But important is, again, and you have seen that before, you need at least a group of doctors who are really going with these patients. They do need a contact person. They need to have a relationship to a doctor, even if we're talking at the level of university hospitals. It would never work if different fellows or different specialists would cope with these patients. They are lost in a university center or in large centers. They need a coordinator, and that at best is a doctor who really is familiar with that disease. Why did I say this is vascular disease? And if we look on the sentence, this is multiple arteriovenous malformations, and from now on I would talk about AVMs, arteriovenous malformations. And the problem here is that the vascular system that comes from the artery, that gives the oxygen and the nutrients into the tissue, and then here are the small capillaries, and then this goes over back to the veins. And this small sized capillaries are missing in the morbus osler. In different organ systems, it can be in the skin, it can be in organs, and that's the problem with morbus osler. So it's the lack of intervening capillaries and the direct connection between arteries and veins. And that can be large or small sized. I'm coming back to that, but I think this is a key message. This is the disease. This is the lack of intervening capillaries. That's a problem in our human being, and that's a problem with the disease with Osler.